Well, we can speak now to Alison Pollock, who's the Professor of Public Health at Newcastle University. Good afternoon to you. You've expressed scepticism about mass testing. Why?
Well, I think the first thing to say is the government has spent £12 billion on a centralised, privatised contact tracing system that doesn't work. And now it wants to spend £100 billion mainly on private sector contracts on Operation Moonshot. That's the mass testing programme. It hasn't even got the basics right, but there are really a lot of concerns because mass testing is screening of a healthy, well population. It's a very complicated and complex intervention, and this really should have been trialled with small pilots and where the tests have been carefully evaluated. And we're looking also at the harms as well as any potential benefits. So here's the government rolling out a huge programme without having piloted it to look at harms or benefits or costs.
I'm so sorry to interrupt. I note your opposition to private contracts and your views about private intervention in the NHS are well known. I just wonder, from a scientific point of view, what are your objections to mass testing?
Well, the evidence for the private sector involvement is scientific. It's based on very good analysis, and we have the evidence with the failed test and trace. But I'm going to come back to the issue of the screening. The government has a test which is putting out tests at the moment, but these tests, the public have been given misinformation. It is not a test which tells you whether you have infection or whether you're infectious. It simply tells you whether you have bits of the RNA virus. Now, in a place like Liverpool, where the rates of infection are falling dramatically, it's very likely that quite a lot of the population will have evidence of old infection. And that, especially in children, could result in them being isolated unnecessarily and harmfully. The second thing about this test is not only is it not a test that tells you whether you have infection or infectiousness, these tests have not been properly evaluated in community settings. This is a real worry. We do not know whether they work and what they tell us in community settings. And the government's just spent £100 million for Liverpool buying something called Innovatests, which explicitly say they should not be used in community settings. The third thing to say is the WHO and SAGE have said focus on identifying people with symptoms and isolating them. It's really important to do that, and they do not recommend mass asymptomatic testing. And that is also because we have not established whether the screening intervention works and what the harms and the benefits are, because it's a very complex programme and we don't know how it's going to integrate into primary care or into public health and how it's actually going to be effective.
OK, thank you very much indeed. Thank you. I'm sorry to cut you off there. We're just slightly short on time. Thank you so much. That's Professor Alison Pollock.